Nearly three-quarters of U.S. adults are considered overweight or obese, according to new research published Thursday from The Lancet. The research points to a substantial increase in overweight and obese adults in the last 30 years, as well as an especially large increase in adolescents aged 5 to 24, with forecasts showing little room for improvement leading up to 2050. In 2021, 75% of adults were considered overweight or obese, and factoring in how weight issues in adolescents rarely resolve, research predicts that number will rise to 80%, or about 260 million Americans. The Lancet paper defined obese adults as those with BMI at or over 30, and overweight adults as those who were aged 25 and over with a body mass index at or over 25. While BMI is not a perfect measure for capturing variations in body structure across the population, experts say it is still the best correlated measure for body fat at a population level. Obesity is higher across gender and age groups in southern and Midwest states, specifically Mississippi, West Virginia, and Iowa, the paper found. I would consider an epidemic. Mary, and I don't know how to pronounce his last name, and who is an affiliate associate professor at the Institute for Health Metrics and Evaluation at the University of Washington School of Medicine, and a co-author of the new paper, told the New York Times. Researchers in the paper called for legislators to take action to break the pattern, referencing the World Health Organization's 2013 to 2020 Global Action Plan for the Prevention and Control of Non-Communicable Diseases. They also reference existing investments from the U.S. Department of Agriculture, the Center for Disease Control, and the National Collaborative on Childhood Obesity Research, but say these efforts have been insufficient in bending the curve. Despite the booming obesity medication market, researchers say the drugs are not widely accessible to all affected populations, and the author writes those clinical treatments should not be viewed as a cure for the obesity epidemic. The release of the research comes after President-elect Trump this week nominated Robert F. Kennedy Jr. as his Health and Human Services Secretary. Kennedy has pointed to rising obesity as a symptom of what he calls a failing public health ecosystem, but argues that healthier lifestyles are a better solution than weight loss drugs. The paper recommends interventions that target driving factors in obesity: excessive caloric intake, sedentary lifestyles, and complex socioeconomic, cultural, and commercial factors, exacerbated by issues like as urbanization, food industry practices, and systematic inequalities. They call on the government to exceed investments into industry, specifically in education, social welfare, food and agricultural systems, and marketing campaigns at the national community level. Quite the interesting news story. Whenever you have an issue that affects most Americans, I always think about how sad it is that we have such a garbage, series of like mainstream news like CNN and Fox and MSNBC, and just how it is a fact that most adults in the United States are overweight, and this isn't being talked about on any of the major networks. They're not running panels and discussions about it. I mean, it is just really sad that such a major issue that can kill you just goes completely unaddressed by mainstream media. And that's, again, going back to this point of how anytime there's something that is afflicting of the average American, they don't really seem to give a damn. Same thing with, the fact that most of us can't afford $1,000 emergency, live paycheck to paycheck. These are things that just never get talked about at all by mainstream sources. I guess we can start off with some anecdotal evidence. I've talked before about how, so like the thing about adults is that when you get older, your metabolism is supposed to slow down and it becomes harder to, I guess, just burn off calories the way you used to. The idea, though, is that you're not, just eating excessively, or you're still, physically active. But what I've noticed a trend of is that there are a lot of these young girls who are like, and people always make the comments about, oh, this lady, this girl, she had a baby and that's why she's so. But in all seriousness, there are like girls who are as young as 16, 17, 18, just massive, and it's like that is really scary from the standpoint of, you know, that this is supposed to be the period where your metabolism is at its strongest. So if it's not being curved now, it's very likely that it won't ever be. But just to go into some specifics, because the article mentions some of the stuff. So these drugs that people take to I guess have weight loss. I like that RFK Jr. said that he doesn't believe it is a cure, or that it's not effective in terms of like as certainly as much as just having a healthier lifestyle. That's true, because the thing is, most people probably do not have access to those types of drugs and should not have to take those types of drugs just to lose weight. You know, we have a society that incentivizes pretty much poor, I guess, lifestyle choices, either in terms of a lack of exercise or just an intake of a whole bunch of foods with calories. You know, you go to these different fast food places and you don't know what the hell they put in these burgers, and then you go to look at pretty much any, I mean, look at the way that stuff is set up with these streaming services like Netflix, or you know, if you go and play one of these games for, you know, 6, 7, 8 hours a day, some people really will just sit there in their chair, you know, like this. Well, I mean, you can't see it, but in their chair just like this for upwards of 8 hours, 10 hours. They don't go outside. They don't go for a walk. And even the people that go outside, they don't, you know, they're not actually like walking or traveling some far distance. They get in their car and then they go to the next place, and they might walk for maybe, what, 10 feet, and then just go, you know, be standing in the same spot or whatever. Like, it's really disturbing when you think about how just little exercise people are getting, and how it makes a lot of sense when you consider that there's really no incentive by society for us to do anything physical, other than when we have to, you know, work. Which, I mean, it's like you get paid to work, but if you want to be healthier, I think you'd be better incentivized if you actually did it out of your own desire. Like, just, you know, it's not something that you should really only be doing when you're clocked in. And the paper's talking about interventions for targeting driving factors. I really don't know what you can do, because the way that like a lot of these businesses are set up is that, you know, you're a body, and of course, as a body, they have you like doing physical manual labor things. But when you look at most of the stuff that people are buying, you know, whether it's these different shoes that they don't want to dirty up, or again, some game that they just sit in the chair playing all day. I mean, hell, with a lot of you know, female products, which are factually more so aimed at looking younger, they never address obesity. They never say, hey, when you put this makeup on, go for a jog. And man, I've been, you know, I wish the article went more into this. Like, I really wish they talked about the gender gap, and I'm only saying this anecdotally. So I've seen, like, I've seen some guys, right? They might have like a little belly, but the obesity on some of these women is really disturbing. I'm not saying it to be funny, to make fun of anyone, any type of non-serious thing. I've seen some of these women that are, I mean, it's oh my God, you know, you have the thing with the neck, and then the little tiny fingers. And I guess for me, I just sometimes wonder, because like I talked before about how a lot of this stuff is so expensive. You know, I have to pay all this money for gas and the stuff at the house and all the rest. It's like, I always wonder, how often do these people eat to where like they're just so massive. You know, that's a thing that really, and like I said, main thing to take away from this: these are not women who are girls who have had, you know, 2, 3 kids, and you know, they're sitting at home playing Xbox all day. Some of these girls are like early 20s, not even 20, and they have just these enormous like sides and the stomach sticking out and the flabby arms. I'm just, again, like, it is scary that people who are this early into their lifespan look that way. And we have a media that will never talk about this, and a government that in all likelihood will never do anything about this. Um, and it's really sad because this is dangerous. It's not healthy. If you get to a certain amount of weight, you can again encounter more health issues than you would if you didn't. It is not something to play around with, and it is a major crisis and epidemic and issue. But because the forces and powers that be don't care, and people are just, in a lot of cases, content to be what they are, um, we're probably going to see this increase. It's insane. A majority of adult Americans are overweight, and no one is talking about it. No one is saying that's disgusting. They need to do something about this. And I said, when you have like a societal issue that's just affecting so many goddamn people, there should be a government program for that. There should be some kind of health classes or health courses, or just some incentive for people as a group to ward this stuff off. But I guess we'll just keep eating unhealthy stuff and dying prematurely, if not before that catching some type of disease that afflicts us even further. So we've made our bed in this mess, and into the toilet we go.